Hi there, it's Friday and welcome to the daily video blog that we've been running now for about 4 weeks, I guess now, bringing you news and updates on what's going on across Buckinghamshire to help you as residents and local businesses survive the current coronavirus emergency that we've got here. Today we have another guest. We have Dan Flecknoe from Public Health, and that's part of the council organisation. Dan's going to be talking about a whole range of issues to do with the crisis in response to many of the questions that you've been asking in terms of how do we compare with other parts of the country, how well prepared are we, but also talking about some of the issues around keeping your mental health good at times like this, which can be really challenging as well. So we've got some great information coming from Dan in a second. Just a couple of quick messages from myself. First of all, there's been some confusion, and I saw that on a newsletter I got from my own parish council last night about the enforcement of parking restrictions. One of the things that I've seen reflected is the fact that the council is no longer enforcing any parking restrictions. That's not correct. There are still parking restrictions, particularly, for example, disabled bays, but also double yellow lines. So when we've said we're not enforcing yellow lines, what was meant by that originally was single yellow lines, those that are normally time measured, for example, 1 hour during the day or whatever, when parking is restricted. But if you're on double yellow lines, you still risk getting a parking ticket. So please be aware of that and park with consideration. The other message, just to reinforce with the weekend coming up, is the issue of burning waste. I understand entirely the frustration because obviously green waste collection suspended across the county area at the moment, as we're prioritising removing household waste, the normal residual waste, and the food waste from properties. But please try and resist the temptation to then just stick it in a burner and burn it over the weekend. It's not illegal, but it's really antisocial, and it can affect people who suffer from things like asthma or breathing difficulties. Also, quite frankly, if it's a decent weekend, having someone else's smoke coming into your house through an open window can be really antisocial as well. So please consider others when you're considering that and look to compost waste instead at the moment. So having said all that, I'm going to hand over to Dan, who's going to give us a rundown of the health situation across Buckinghamshire. Dan, over to you.
Thank you very much, Martin. So the public health team of Buckinghamshire Council is working with a real range of organisations right across the health and social care sector and across the whole of Thames Valley to do everything we can to protect the health of the public in this crisis. I think most people are aware that London is getting very much the worst of this situation at the moment, and we don't know whether numbers in Buckinghamshire will stay relatively low or whether they will over time rise up to a similar sort of level as London, but we have to be prepared for that sort of thing. So that's a lot of the work that we're doing. At the moment, the numbers in Buckinghamshire are about 550 confirmed cases, but we know that that's an underestimate just because of the way that testing is being done at the moment. So in some ways we won't know the full scale of this until afterwards. But of course it is worth emphasising that most people who get this disease will have very mild symptoms or no symptoms at all. Some of this may be really familiar already, but I just wanted to talk about the two main ways that coronavirus spreads, because it does link very directly to the precautions that we're being all asked to take. So the first way that coronavirus spreads directly is if, for example, I cough or I breathe, if I have the virus, then I'm coughing or breathing out viral particles which will hang in the air for a short period of time, and then you might breathe them into your lungs. Now, that they don't travel very far. That's why social distancing and trying to, wherever possible, maintain 2 meters separation from other people who aren't part of your household is advised, because that pretty much reduces the risk of direct transmission of this disease. The second way is indirect transmission. So again, assuming that I'm a coronavirus sufferer, I cough into my hand and then I walk out of the room, opening the door handle and leaving viral particles on that door handle. A couple of hours later, you use the same door handle and then transmit the viral particles that you've picked up to your face. That's why hand hygiene is being emphasized so much, and keeping our hands really clean, ideally washing with soap and water. If soap and water isn't available, then alcohol hand sanitizer of 60% solution or greater. So all of these things are being recommended for a reason. And of course, if you develop symptoms, and the two symptoms that we ask people to look out for are a persistent cough and a high temperature, if you develop those symptoms, even if you don't feel unwell otherwise, people are being asked to self-isolate, and that means staying in your home, not going out, not seeing anyone else for 7 days. And that 7 days is to allow your body to deal with the virus so that you are no longer infectious anymore. And other people in your household are asked to self-isolate for 14 days, and that's to allow the virus to be transmitted around the household and for everyone in that household to process it, get it out of their system, and to become non-infectious and non-dangerous to others. Because a lot of these things we're doing both to protect ourselves and to protect other people. Although the disease is very mild for most people who get it, there are some people in our communities who are very vulnerable to it, people who are elderly, people who have serious health conditions. So we want to do everything we can to protect those people. And also these things help to slow down the spread, and that's really important. It might seem like, you know, this is a novel disease, a novel virus. Perhaps we're all going to get it eventually. And if we're all going to get it, well, why not just get it out of the way? The problem with that is that the health service has capacity limits, and what we don't want is everyone who's going to get sick getting sick in a very condensed period of time, because that would put far too much strain on the health service for those people who do need hospitalization and that smaller percentage who need intensive care support. So by spreading things out, the best analogy I can think of is if you were, let's say, recruiting a new member of your team or someone for a job, and you had to do 10 interviews. It would be really stressful if you had to do all of those in an afternoon, whereas if you could spread them out over the course of a week, that would be more manageable. So that's what the health service needs our help with, to spread out these cases over a more manageable time period. Obviously, we all know that our frontline service workers are really going above and beyond at the moment, not just people in health and social care, but people who collect our rubbish and the people who prepare our food, all of these essential services that we rely on so much. But I did want to say something about the health services particularly. With coronavirus so much in the news, it's easy to forget that people are going to get sick with other things as well. People are still going to keep having heart attacks. People are still going to keep having strokes during this period of time. People will continue to get injured and unwell in other ways. And it's really important, if you have an urgent medical problem, that you seek help. There is some data and some suspicion that people may not be going to A&E, may not be contacting their GPs when they really should. And that may be done out of a sense of responsibility, not wanting to put more stress on the service, or a worry that if you go to a GP or if you go to A&E, then you might be exposed to the virus. And that's totally understandable. But I just want to stress how important it is that if you have urgent medical problems, or someone in your family does, that you seek help, because the services are still there for you. And every precaution necessary is taken in those settings to make sure that you would be safe and that you would be kept separate from people who may be infected with coronavirus. The last thing I wanted to mention was our mental and physical health, because this is such a strange and novel situation for us, and it's causing a lot of stress and anxiety. And the rumors and conspiracy theories circulating really don't help with that sort of thing. So I would encourage everyone to rely on the trustworthy sources and credible sources of information, which you can find online at phe.gov.uk. So we have to be, I think, taking a special good care of our mental and physical health at the moment. I really would encourage everyone, if you can, to get out and take your daily exercise, to find new ways to keep yourself active and interested in your own home, to stay connected with loved ones, to support each other, and to even find possibly new opportunities out of this really difficult and challenging situation. We may find new skills and talents and hidden depths within all of us. But if you or someone you know is suffering with mental health problems, I should just emphasize that a mental health helpline has been set up during this crisis for residents of Buckinghamshire and Oxfordshire. And if you are struggling, please don't struggle alone, because this helpline is there for you. So the number is an Oxfordshire dialing code, so it's 01865. And then for adults, it's 904 997. And for children and young people, it's 904 998. That's a 24/7 helpline, which is available for anyone living in Buckinghamshire or Oxfordshire who is struggling with mental health problems. 01865 904 997 for adults, or 998 for children and young people. And yeah, I just hope that everyone's able to keep themselves safe and well in this difficult time. Thank you very much, and back to you, Martin.
Thanks very much, Dan. I think some really useful points there, picking up on a lot of the issues that people have been raising with us via various messages into us in response to these daily video blogs. So thanks very much for that. Just a couple of points I'd like to re-emphasize. You know, I actually was stopped in my own village yesterday evening by our local GP, who was actually concerned about the number of people who weren't going to see him now. He'd actually had a significant drop off at regular attendance. And he was worried that people who might be suffering from things like heart conditions or potential strokes were just not getting the attention they needed. So, you know, the message to all of us really is, you know, if you think you've got a serious medical condition, please make sure you attend your GP. Don't hold back. Don't think you're blocking up the NHS at the moment. You know, there is the capacity to see you on these sorts of conditions. So please utilise that service. It's really important that you do that. And the other just thing I'd like to say on a personal basis is on the mental health side, the importance, as Dan said, about daily exercise. You know, I sit on the computer probably most of my day, but I try and make a point every evening about 6 o'clock, 7 o'clock of getting out and just going for a walk or a cycle. And it really does refresh you, and it gives you that whole sort of new mental outlook on life when you can get out the house, just stay socially isolated, but get some exercise. So again, with the weekend coming up, please be careful, please stay socially isolated, but don't forget, you know, to refresh yourself mentally, get out there, get some exercise, have a great weekend, and see you all next week. Thanks a lot.